There are many different forms of blood cancer, and they're actually fairly unique. It's a very kind of lonely situation, and I didn't even know what questions to ask. Being able to find somebody that I could talk to that was knowledgeable and that sort of did not diminish my feelings was just enormous. It just changed everything for me.
Clinical trials can be very daunting, and people assume that clinical trials are a last resort many times. At any time in a patient's diagnosis, it's an appropriate time to get in touch and establish a connection and just explore what's out there. It doesn't mean you have to pursue a clinical trial, but it's always good to know all of your options so you can make an informed decision about your care.
When you're dealing with healthcare and you're dealing with doctors and nurses in sort of a clinical setting, there's just always a distance. And I think I can respect that and understand it to some extent. But in dealing with Susanna and dealing with LLS, that distance does not exist.
We do primary nursing in the Clinical Trial Support Center, so when Kate comes in, she's with me forever. What's nice about that is that you're really encouraged to develop a relationship and to have a connection.
You're always sometimes looking for something more from your doctors, and it's just not there. And it was there with Susanna and with the whole system that LLS has.
I love working with Kate. She's fun, and every time I hear her voice, it brightens my day. I'm Susanna.
I'm Kate.
I'm a clinical trial nurse navigator.
I'm a patient, and I refuse to be defined by my cancer.